and review it. And Michael, can you confirm that you can see my PowerPoint?
Now I can, yeah.
Okay.
I see your team's stuff first, but I can see your PowerPoint. If you can just make it full screen.
Yeah, I'm going to go into presentation mode. All right, so we can get started. So yeah, this is the Emergency Housing Voucher Program. As I mentioned, we received funding for this program starting on July 1st. So we are getting very close to being able to actually start operating this program. We expect to start kind of receiving referrals, and I'll go into the referral process a little bit as soon as next week to start assisting these households. So for anyone that does not know me, I'm Jeff Zingolowitz. I'm the Director of Housing Choice Programs here. I've been here for about 4 years now. And then in addition to me, we will be hiring an additional staff person to assist in this program. So there will be a kind of EHV analyst position. So once we have that individual identified, they'll be the main point of contact for all LSAs on any questions regarding this program and also claims, which I will get into later in this presentation. All right, so a quick summary of the EHV program. This is kind of stuff that was mandated by HUD. So the Emergency Housing Voucher Program can provide households who are referred to IHCDA through their local continuum of care coordinated entry list. The Indiana Balance of State continuum of care has created some referral policies that are going to prioritize the most vulnerable households on their coordinated entry list in each region. And I'll get into the different regions that the Balance of State COC has for those of you who are not familiar for it. And then IHCDA has been allocated 338 of these vouchers. And we have until September of 2024 to lease up these 338 vouchers. But there are some incentives to get them leased up faster than that, which I can go into a little bit more later. And then in addition to rental assistance, as I mentioned earlier, the EHV recipients are also eligible for some services to increases their chances of finding housing and staying stably housed. The services that we're going to kind of be reimbursing LSAs for are really focused on housing search assistance and taking care of some of the barriers that these households experience when searching for housing. All right. So the Balance of State Continuum of Care, what is it? It is an entity responsible for aligning the state's homelessness resources to best serve those experiencing homelessness. So obviously, as a state, we have a lot of different resources coming in the state from HUD, and then also just a lot of organizations that are doing good work on homelessness. And the responsibility of the Balance of State Continuum of Care is kind of to align all those resources to make sure that we're utilizing them together in a way that makes sense, to make sure that a household that is being assisted by a transitional housing facility might be connected with a permanent supportive housing situation if that makes more sense for them, or make sure that households who are experiencing homelessness are being connected to the services they need and the services that make sense for their particular instant. So there's a map there of the 14 different regions that make up the Balance of State Continuum of Care, and those are also the regions for the coordinated entry list that are maintained by each region. So, there's a separate point of contact for each CE list, and there's a link there. It's on our website of the main point of contact for each CE region. And if you have a household that's maybe calling your LSA and saying, we heard about these EHV vouchers, how do we get on them? If they are experiencing homelessness, you should connect them to that coordinated entry point of contact for your region, and that point of contact will be able to evaluate them or connect them to someone that will evaluate them to determine if they are eligible to be added to their local coordinated entry list. And then eventually, if they are at the top of that list, which is depending on a vulnerability assessment that they do, then they may be referred to us for a EHV voucher. So the referral process, it's similar to the VASH program. So we'll have a single point of contact at IHCDA that will be our EHV analyst once they are hired. Prior to that, it will be myself, who will receive all the referrals directly from the local coordinated entry systems. Once we receive that referral, we will determine which LSA the referral is assigned to based on the location the family would like to live. And then IHCDA will add that household to Occupancy and Housing Pro and forward the referral packet to the LSA. And similar to VASH, the referral packets, they should always contain all necessary documentation to determine initial eligibility. There may be a few instances where maybe it doesn't, but IHCDA staff will work to get that prior to forwarding it to the LSA for LeaseUp processing. So eligibility, this is set by HUD. The only denials for this program are the two mandatory HUD reasons. So a household member that is subject to a lifetime sex offender registry and a household member that is convicted of manufacturing methamphetamine in federally assisted housing. IHCDA will check those things before assigning a household out to an LSA. And Michael, if you want to omit anyone that's in the lobby, thanks. So since these households are being referred from homelessness, they may not have possession of some of the normal eligibility documentations, birth certificates, social security cards, photo ID. So HUD has allowed us to accept documentation that these items are being ordered in place of the actual documentation. So instead of a social security card, they can provide a letter from the Social Security Administration that's showing that it's been ordered. Same with birth certificate, a letter from the health department where they were born showing that it's been ordered. So you may receive a referral packet that instead of having those actual items, it may just have a letter that shows that they've been ordered. If you receive that referral packet, you can proceed with leasing them up as if they had those documents, but you'll just need to make sure that you follow up with the households to make sure those items are added once they are received by the households. All right, so kind of the new exciting part for this program is the LeaseUp services that can be provided. So HUD has provided IHCDA with some services funding to provide these households with assistance so that we can help them get leased up, understanding that since they are coming out of homelessness, they may not have some of the resources of our normal voucher families that are looking for housing. So I'll kind of go through these LeaseUp services that we can provide. One is security deposit assistance. So if an LSA is able to provide security deposit assistance, we will reimburse for the security deposit assistance for the lesser of 2 months rent or the actual security deposit required by the owner. If your accounting team or finance department has concerns about being able to get that on a reimbursement process and instead wants the money up front, it'd be much easier to do a reimbursement. But if you do have concerns, let us know and we can work to figure that out. Another service is utility deposit assistance and utility arrears. So once again, LSAs will reimburse for providing utility deposit or arrears assistance for some or all of the family's utility deposit assistance expenses. And that assistance may be paid directly to the family, but must be supported by an invoice or bill from the utility company. So that is really meant in the case where the utilities are going to be in their name at the unit that they are leasing, so they need to be able to provide pay off any arrears that they may have or utility deposit to be eligible to have utility service turned on in their name at that property. If that is the case, you may provide assistance and we will reimburse, and you'll just need to provide a bill or an invoice from the utility company showing that what that amount was that was paid in assistance. And I'll get into the exact process for filing those claims in a moment. All right, so some additional services, application fees. So that one's pretty simple. If you are helping a household to apply for a rental assistant or a rental unit and there's an application fee, you may pay that application fee and submit it to IHCDA for reimbursement. There's no limit on how many of those you may pay. So if the household applies for 10 units and there's 10 application fees, we'll reimburse for all 10 of them. All right, and then another services item, and this is one that IHCDA is going to handle directly. So it will be a new line item on the HAP report, but you don't need to worry about kind of processing any claims or anything for this, is landlord incentive payments. So we will provide landlords with incentive payments at the time of lease up for housing EHV households. This is really meant to provide some incentive because we recognize that some of these households may have evictions on their record. Maybe that's how they ended up homeless in the first place, or have a history of substance use disorder or incarceration, kind of just a history of things that would normally get them screened out by a landlord. So we're providing some incentive to a landlord to say, we're going to provide you with a little additional funds for taking a chance on this household and waiving some of your normal screening criteria. So the way that will be structured is for landlords who have not previously housed an EHV household. So this is the first EHV voucher that they are working with. They will receive a $1,000 incentive payment. That'll be $500 with the first half payment and $500 with the last half payment under the initial lease. So if it's a 12-month lease, it'd be with that 12th month half payment. They would receive the second $500. We broke it up into two payments just to provide them with some incentive to not evict at the first sign of trouble, or not evict at some minor disturbances or something, to try to provide them with some incentive to at least engage in some basic eviction prevention prior to just turning to eviction of the household. And then for landlords who have previously housed an EHV household, so this is their second or later household, EHV household that they are working with, they will receive $500, and then broken up the same way, half with the first half payment and half with the last half payment under the initial lease. All right. And then the final service that we can provide is assistance with moving expenses. So if an LSA provides a household with assistance with moving that should say moving expenses, not moving inspections. And those costs may include administrative fees charged by the property, or purchasing of essential household items such as cleaning supplies, dishware, etc. And that's not an exhaustive list. So if there's other items that you become aware that a household kind of needs to assist in their move, let us know, and we can let you know if that would be an eligible expense or not. There's not really strict guidance from HUD on what is and is not eligible on this item, but it just kind of has to be related to them moving into the unit and things that they may need. All right, so the reimbursement process, Michael has created the form that you see here and uploaded it into Housing Pro. It's a pretty simple form, just kind of asks for the basic information from the tenant, and household, the unit they are living in, the contact information, and then list the 4 services that LSAs can be reimbursed for. So security deposit, application fee, tenant utility arrears and/or deposit, and moving expenses. And then also list what needs to be attached to the form for each activity that is being claimed. So for security deposit, we do have a security deposit lease addendum. We'll be sending that out to the group within the next day or two. That will need to be attached and executed by the tenant and the landlord. That kind of outlines the terms of the security deposit assistance. And the basic terms of that is that if the household is ELP'd from the EHV program for any reason, then the security deposit is returned to the LSA and then to IHCDA or directly to IHCDA, so that we can use it for other household security deposit assistance. Or if the household is able to finishes their first lease term, they haven't been evicted, they're just moving to another property, then that security deposit can be returned to the household so that they can use it towards their next unit security deposit. And then application fees, we just need the receipts or the invoices from the property management outlining what those fees were in the same amount that's being claimed, and we'll provide that reimbursement. And then utility arrears and/or deposits, same thing. We just need the receipts or invoice from the utility company. And then the final one, moving expenses, it would just be the receipts for those items that were purchased for the households, and we'll provide the reimbursement. All reimbursements will be made through the HAP reports. So once you submit this claim for reimbursement, you will see line items appear in the unposted transactions, a screen for that tenant that will display the amounts and the activity that was being claimed for. And then when we run the next HAP report, that payment will be made to the LSA in the same way as your admin fee payments and HAP payments go out each month. And then the final items kind of on this claim form is just the LSA name, the person making the claim, their signature, and then the date of the claim submission. And then these can be submitted to EHV at ihcda.in.gov. As I mentioned, we're hiring an EHV analyst for this program. So once that person is hired, you can also see them on these claims forms because they will be the ones doing the processing of these. Until then, you can CC Aaron. She'll be making these line item additions in Housing Pro. So until we have hired an EHV analyst, you can CC Aaron McCord.
Hey, Jeff, we had a question. Will there be a dollar amount limit on household items?
HUD has not set one, so not necessarily. But I would recommend if you're going over $300 to reach out to us for approval before actually purchasing the items. And there will just have to be good justification for if it is a larger amount of why those items are necessary. All right. And then for the landlord incentive payments, LSAs don't need to track or worry about anything. IHCA staff will track and set up those landlord incentive payments to be paid with the normal HAB report. So all we are asking from the LSAs is to pay it out once you, with that first HAB month payment, and then the last HAB month's payment, but they will show up on the HAB report just the same way that HAB does. And you know, if you're accounting or finance team has any questions about getting those paid out, they can reach out to me or Aaron and we can work with them. But it should really be no different than how they normally pay out HAP. It will just be an additional line item on the HAP report to go out to the landlord. And those will display in the unposted transaction screen and occupancy. So if for some reason you have a EHV household that you just leased up and the HAP report's coming up and you don't see a line item in the unposted transaction screen for that landlord incentive payment, let us know so we can make sure we get it added in there to be paid out with that first month's HAP. At the same time we add the first month's HAP, we will also add the last month's incentive payment in there. So it will show up as unposted, but it'll be 12 months out. All right. All right, and then payment standards. HUD is actually reimbursing or paying PHAs at the actual cost of administering the program, unlike our normal HCB program where they pay us on a per unit cost. They will reimburse us or pay us out on the actual expenses incurred, and they are also allowing us to implement 120% payment standards for the program. So Housing Pro is still going to default to a 100% payment standard, but if a unit fails affordability at 100% and it would be affordable at 110 or 120, whatever it is, contact IHCDA and we can manually override the payment standard in Housing Pro to make it 120%. It's technically just under 120% because we have to round down so that it's not over 120%. However, all units must still pass the normal rent reasonable process. So we can go up to 120% payment standard, but it still needs to pass the normal rent reasonableness and go Section 8. All right. And then this is actually the final kind of main slide. The HQS inspections, and I don't imagine that this will come up very often, but it is an option to be aware of. The units do follow the normal HQS policy. However, HUD has allowed us to pre-inspect units. So if you become aware of a landlord that has said, you know, they're interested in housing an EHV household, you can go and inspect that unit before a household has actually been identified for the unit. And kind of pre-approve it for lease up so that once an RTA is turned in for the unit, you don't have to schedule a new inspection. This just kind of limit that time between an RTA being submitted and the household leasing up. You know, don't feel like you have to do this, but it is an option to be aware of. And then since the unit will not be tied to a specific household, you won't be able to enter it into Housing Pro. So you'll have to have it on paper until a household is identified for the unit, and then at that point you could enter it into Housing Pro. All right, so I'm going to open it up for Q&A. anyone who has any questions, you can raise your hand and we can unmute you, or you can just type a message in the chat. I know that was a lot of information in a short amount of time. And also feel free to email me. So first question, flyer. Yes, we are working on creating a flyer for the program. So once we have that created, we're working with our MAC team on that. We will send it out to the group so that you can provide it. And then on if there's anything that a household needs to do to prove that they're homeless, the coordinated entry system will take care of that. So since these referrals are coming directly from coordinated entry, the coordinated entry point of contact or whoever's doing that coordinated entry initial assessment, they will be doing an assessment to determine how vulnerable the household is, what their current situation is, and realistically, someone is not going to be eligible for a referral unless they are literally homeless. Okay. Yes, I will pull the service map area back up. And I can also pull up the list of contacts. Oops, sorry. And Michael, there's any other questions, if you could read them to me, I can answer them while I'm doing this. All right, so on our website, there is the region list and the contacts for that region for CE. So the CE contact is identified. So if you have a household who is wondering if they may be eligible for a EHV voucher, you can refer them to that CE contact in your region, and they will make sure that they have an assessment done. The nice thing about the CE list is they are not just making referrals to EHV, they are also making referrals and connecting individuals to resources of other homeless services. So just because they may not be eligible for an EHV voucher, they may be eligible for a PSH unit somewhere or other homelessness services. So the CE team will kind of make sure that they are being connected to the services that make sense for them. Okay. Yeah, Gina, as I mentioned earlier, if you have concerns about doing it on a reimbursement process, let us know and we can connect with you individually to figure something out. It could look like IHCA just paying some of these expenses directly, or it could be figuring something else out. And then on arrearages for utilities, HUD has not provided a limit, so it'll kind of be a case-by-case situation, but we have quite a bit of funding for these services and it's restricted to services. So if it's truly a barrier for them getting housed, you know, if it's a lot of money, we still may be able to pay it, or maybe call it to some other arrangement, or try to identify a unit for the household that does not require utilities to be in their name. And yes, Valerie, application fees can be paid out on all EHV clients, even if they do not end up leasing out. So any application fee for an EHV voucher holder, we can pay out. Eddie, I'll unmute you. Actually, Eddie, if you could just unmute yourself.
I'm sorry if I missed this, but I think that part of to help keep people housed, there's going to be supportive services.
Yes, so I have not mentioned that because it's not something that doesn't really involve the LSAs at all, but we will be providing ongoing supportive services through the local community mental health centers to these households. Unfortunately, we are waiting on some funding from FSSA, Department of Mental Health and Addiction, for that, so that funding is not going to be available until September 1st, possibly a little later, so there is a little gap here at the beginning of the program. But once FSSA receives that block on grant funding from SAMHSA with the federal government, we will be entering into agreements with the local community mental health centers in your areas. We plan to and are confident that we'll be able to have coverage across the entire state. So when a family is being referred to IHCDA, they will also be referred to their local community mental health center, who will be able to provide them with ongoing mental health and any kind of health service that they may need to address some of their underlying conditions that may have contributed to their homelessness in the first place. And that will not really require that'll be happening in tandem with the household that's working in with you all to get leased up, but you will not necessarily need to be connected or with the CMHC or anything, but they will be being offered those services and being connected to those services, and IHA will be providing some funding to those CMHCs to do that work.
So, so when they come out of coordinated entry, will they be assigned a person through the local behavioral health, mental health place before they come to us for housing, or will they come after? I mean, that might
Yeah.
be
Mm-hmm.
okay.
So initially I mentioned that the CMHC funding is still a little over a month away. So some of these initial referrals may not have been connected to the CMHCs yet, and we'll be connecting them as soon as we have the funding in place. But once that funding is placed, they will be referred to similar to VASH, how, when you receive a VASH client, they have already been connected to the VA and are receiving those services. By the time you are receiving the referral from us, they will have already been connected to the CMHC and been offered and hopefully are receiving any services that they may need.
Yeah, that helps a lot. Kind of comparing it to VASH. Um, I would recommend if it's possible for whoever's working on housing have a relationship with whoever's from the mental health. If the goal is to keep people housed, it's going to make things a lot easier if there's open communication and whatnot. But we'll just have to cross that bridge when we come to it. Thanks, Jeff.
Yeah, and we will be having at IHCA ongoing meetings with the coordinated entry leads and CMHC service providers to kind of go at case conferencing meetings to go through any issues that may be occurring with an individual. So if there is a particularly difficult household or household that's going through something, we may reach out to you and ask for your input or invite you to one of those meetings so that we can meet with the CMHC service provider and coordinated entry partners to figure out what is going on and create a plan that's going to try to keep these households stably housed if any issues do come up. Another item that some of you may be aware of already, I did send out updated LSA agreements to your executive directors last week. Those will be going out for execution later today or tomorrow. So if you are involved in those the LSA agreement process, you may want to reach out to your exec director and make sure that they receive that. And there's some additional details in there, depending on how your agency operates, that you may need to know about. Valerie, regarding families being EHV families, they cannot be both. So if they are already a FUP voucher recipient, they cannot be an EHV recipient. However, if a FUP family is experiencing homelessness and they have not been referred yet, they may also be eligible for EHV. So they should be connected to the coordinated entry so that they can be evaluated to see if they are eligible for an EHV referral, and then they could be referred as an EHV family instead of a FUP family if they are eligible for both. But FUP families are not eligible for these services. All right.
Hi, Jeff. It's Gina.
Thanks, Gina.
Because these clients will most likely need ongoing case management even after we house them, are we able to claim these for family development moving forward? Because most likely these are going to have a caseworker.
Yeah. Who is your family development contact at IHCDA?
It was maybe Veronica Watson. I don't believe we have one.
Yeah, Veronica. She's at LVO now.
Gone.
So I will get with Emily on that and contact with her. That is a good thought. I haven't looked into it at all, so I will reach out to Emily and see if that's an option. But it would make sense that it would be, and I'll get you guidance on that. And if any other LSAs also receive those family development dollars, let me know, and I can get you guidance as well.
Well, we currently have a family development program outside of housing. So what my inquiry is specific is to the housing choice voucher, how we used to be able to get reimbursed for the family development cases that we had. So that's, it's specific to housing. We do have a regular family development program as well that we use CSBG for.
So you're talking about receiving funds not from CSBG for these housing funds, housing funds. We do not have anything available. If you look at the LSA amendment, there is increased admin for these households. So that's really intended as a recognition that there is increased services that you're providing, as we will be providing the additional admin above what the normal rate is.
Okay, thank you.
Thanks, Michael, for taking care of Valerie's question there.
Jeff, I don't know if we answered this. Gina, you had also asked about, is there a limit of the arrearages for utilities?
I did cover that, Michael.
All right. Sorry.
You're responding to another message of them. All right. So. All right. Well, if no one else has any questions, feel free to leave. If anyone does have any questions, I'll still stay on for another 5 minutes. If you think of anything, feel free to unmute yourself and ask away. But for anyone that doesn't have any questions, feel free to get off.
Hey, Jeff, when can we expect to start accepting or receiving these referrals?
So it's going to depend some on your local coordinated entry team. I know, for example, Pam Isaac and Kokomo is like ready to go and get these our referrals to us right away, but some other coordinated entry systems may be a little bit slower. So I would say, I know up in your region, it's Jordan Stanfill. He's usually pretty on top of stuff, so I would expect to start receiving them in August. First half of August, probably.
Is it possible to request that you'll email out the slides for us for reference?
Yeah, we will mail out a PDF of them, and then with that, we'll also mail out the recording of this conference.
Thank you.
Hey, Jeff.
Yeah.
One thing I don't know if you had covered it. For the tenant IDs, are the caseworkers, are they going to just assign it, or are we going to assign it and then that's just what they'll keep?
Yes, same as VASH. So with VASH, when we enter them into occupancy, we're creating a tenant ID. So there will be a tenant ID when they are assigned to you in occupancy already, and those will start with the EHV. All right, well, it looks like there's just a dozen or so people left. So, you know, if you do think of any other additional questions, feel free to email me or give me a call, and we'd be happy to answer them. I'm sure more questions will come up as we get going, and things that we didn't anticipate will happen. So we're here, and as soon as we have the new EHV analyst identified, we will send their contact information out to everyone, and they'll kind of be the main point of contact for this program. And I will, usually takes about an hour for the recordings to process. So once that is processed, I will send it out to the group along with a PDF of the presentation. All right. Thanks, everyone. Thanks for joining on pretty short notice. Bye.